in this video, we're going to talk about our two newest features. As you may have noticed, we have these two new buttons right here, our horizontal prompts button and clinical delta. So first, what do we mean by horizontal prompts? Well, basically, as you can see, this button is in both the transcript and the generated note. And it means you can simply prompt the AI to do something with either of those things, right? So let's say you want to generate a new note with a different template using your transcript, and you no longer have to manually copy your transcript and along with your template and put it both in here and click submit. Now it's more streamlined. You can simply click this button and select a new note or a new template rather, and then you can generate a whole new note or summary or anything you need using your transcript in a much faster way. And same thing with your note. You can prompt it to either maybe edit your note. We know that some of you prefer to use text edits, so now there's an easier way for you to do that. And you can also do things like maybe ask it to generate a table using that note or a mind map maybe. And if you want to know how to do that, we have a video on that as well. Or really anything else that you might need to do with the note. And as you may have noticed, we specifically added this button because when it comes to AIs like maybe ChatGPT, for example, you all probably know that when you interact with the AI, you have a conversation with it, it remembers previous outputs or previous messages, right? And it can continue the conversation. And that's not the case with the Cura. Whenever you generate a new note, it kind of starts completely fresh. It's completely new. And this is specifically, it doesn't remember the content of previous notes. And this is specifically done to avoid AI hallucinations. But we know that you might need to do something with previous notes sometimes. Maybe you want to blend two notes together. So basically, this is what this button is for. Now, our clinical delta button, basically what it does is it takes the last two notes in your thread, a previous visit and your newest visit, and it turns them into a progress table of sorts where it kind of compares those two visits and gives you the difference between the two, giving you your patient's progress over those two instances, right? So let's look at what it generated. I already generated one here. You simply click on the clinical delta button in your last note, and it's going to use it with the last note to make this table. And why don't we go ahead and look at the HPI here for these two notes. These are two consecutive notes of a fake patient with diabetes. As you can see here, the dates January 1st and February 15th, same here and same here. Just so you know, it is those two notes. So here in the HPI for January, the patient was feeling fatigued, had excessive thirst, frequent urination, and unintentional weight loss. And then in the second visit, the patient mentioned he was adhering to therapy, but was still experiencing these symptoms of fatigue and weakness. And also, if we go down to his lab results here, we can see how the creatinine is increasing and also the BUN. So we can see his renal his renal function is worsening. So as you can see, this table can be pretty useful, so you can have a visual of your patient's progress, hopefully an improvement instead of worsening. But there you have it. That's how you use our two newest features.